Alright, hi there. Let's get started. So as I walk in my patient's room, I'm going to be doing a quick Houston assessment. We're going to see that he has a wristband on. We're going to see that the right staff is on the board. We're going to look for oxygen. Doesn't have any oxygen on. Doesn't have any feeding tube. Doesn't have any abdominal tube. Doesn't have chest tube. Doesn't have a trach. Doesn't have a Foley. We have an IV started, running D5 saline. In the left AC, no signs of infiltration. We don't have any bed rails. The bed's in the lowest position. Call lights within reach. No obstacles. There is patient-assisted devices within reach. We have urinal at the bedside. The commode is empty. So we're going to walk up to the patient. Hi, how are you doing today, sir? My name is Wyatt. I'm going to be your nurse taking care of you. I'm going to do a quick assessment, if that's all right. So I'm going to wash my hands, put on my gloves. We're getting a general appearance of the patient as we come in. Seems to be breathing fast, slightly agitated, and decreased mental status. So I'm going to say, can you tell me your name and your date of birth? I'm going to check that on this bracelet. Can you tell me where you're at? And can you tell me what day it is? So he gets 2 of those. He's LOC times 3, or times 2. So first I'm going to take my pen light. I'm going to examine the eyes, make sure that his pupils are equal and reactive. We're going to look in both of his ears for any drainage. Don't see any of that. We're going to look for any jugular vein distension. Don't have any of that. Ask him if he's in any pain. He says no. We're going to palpate on the chest. Ask if there's any pain there. He says there's no pain. We're going to listen to his lung sounds. So 8 spots in the front, starting up above the collarbones. Take a deep breath. Okay, lung sounds are clear. On the right side, we do the Z pattern with 4 spots. And on the other side, we do a C pattern of 3 spots. Lung sounds are clear, equal bilateral. We're going to listen to apical pulse for 60 seconds. S1, S2. Next, we are going to get a neurological assessment and say, can you squeeze my hands? Strong. We're going to feel pulses equal bilaterally. Can you pull your hands towards yourself? And can you push away on my hands? Okay, good. Check cap refill, less than 3 seconds. Next, we're going to listen to bowel sounds. Okay, we have some bowel sounds. Going to palpate the bowels, feeling for any masses or distension. Doesn't appear to be any. Can you tell me when your last bowel movement was? Okay, and urination, is there any issue there? Burning, drippage? Okay, none. That's good. We are going to go to the lower extremities, looking for any edema, checking the cap refill, checking the pulses, make sure they're equal bilateral. And then we are going to listen to the lung sounds on his back that we forgot to do earlier. So Mr. Logan turns over for us here. Listening to 10 spots on the back. And they are clear. While he's over, we can check the rear for any signs of ulcers. We will check our monitor for our vitals, which are temp 98, pulse 87, respirations 32, blood pressure 123/77, and SpO2 of 96. So when we are reporting off of our shift, this is Mr. Logan. He came in with increased respiratory rate. He had a blood glucose of above the max. He was started on insulin. His vital signs were normal aside from his respiratory rate. Physical assessment didn't find any abnormalities. He had labs drawn. He had increased glucose, decreased pH. He had decreased PCO2, and he had decreased HCO3. His urine was also positive for ketones. So the healthcare provider ordered him insulin along with saline, and his glucose has come down to 174, and his anion gap is still elevated. It came down to 12 actually, so his anion gap is good now. His pH has come back up to 7.36, and he has been taking off the insulin and is preparing for subcutaneous insulin. He has been known to be non-compliant with his insulin, and that was the reason that he had to come in today with a diagnosis of DKA. So yeah, that's it. Hopefully this is what y'all wanted. If there's anything else, feedback would be awesome. So thank you.